My name is Mariah Stopai, and I did my research project on the use of the Buzzy for effective pain control in children undergoing needle-related procedures. This is important to nursing because nurses are the ones that are putting IVs in these children. They're the ones that spend the most time with the patients. So it's important that we control the pain in pediatrics because needle-related procedures are a common source of pain in the pediatric population. About 10 to 20% of the total population has a fear of needles, so we really want to do everything we can to decrease the pain associated with these procedures. Children that experience pain have poorer experiences with needles as an adult and face cognitive and motor developments, along with an enhanced pain sensitivity and a maladaptive pain response later in life. Needle phobias can lead to a delay in seeking treatment, especially those requiring needles such as vaccinations or blood work. So it's important that we do everything we can to minimize the pain associated with anything needle related. So that brings my PICO question together. In children 4 to 18 years old, how does use of the Buzzy compared to no intervention at all affect their pain during injections, blood draws, or IV insertions? My literature search, I used Google Scholar and CINAHL, and my keywords were Buzzy, children, pain, cold, and vibration. I used limitations for the years of 2012 to 2019. They had to be peer-reviewed nursing journals and the linked full text. My final 3 research articles that I used were United States-based, and they answered my PICO question and had significant nursing practice recommendations. The first study I did was by Redfern, Chen, and Sibrel. They looked at the effects of the Buzzy during vaccinations on anxiety and pain in the pediatric population. And they found that anxiety ratings did not differ between the groups, but the post-procedure pain was significantly lower in the group that used the Buzzy. And the group that used the Buzzy did not think the pain would hurt any less than those in the control. My second article that I did was by Whelan et al., and they looked at the impact of a vibrating device, which is the Buzzy, on IV insertion in children. And they found that 80% of patients that used the Buzzy said they would like it to be used again for their next blood draw or IV insertion. 70% also said that it did help control their pain and they felt little or no pain at all. And 80% of phlebotomists using the Buzzy said that it made the procedure easier for them. And my final study was by Curl et al., and they looked at a combined pain management of the Buzzy plus the J-tip, which provides lidocaine with a no needle. And they found that using the Buzzy with the J-tip, the pain was always 0 out of 10. And when there was no intervention at all, the pain was 5 out of 10 on average. So the overall findings did say that the Buzzy is effective at controlling pain, but when used with another pain control device, such as the J-tip or television, it was even better. So recommendations for practice: the Buzzy should be used because it is cost effective, very easy to implement, and can significantly impact the pain reported by children by decreasing it. It is practical and acceptable to both parents, the patients, and phlebotomists. The procedure was easier and the parents were more happy with their doctor visit that day when the Buzzy was used. And it is a device that is well accepted in practice. It's easy to use, cost effective, and does not take a lot of time. Using the Buzzy with another form of pain control, such as the J-tip, distraction cards, or television, is an even more effective way to reduce the pain. And in conclusion, nurses must assess and manage the pain associated with needle-related procedures. Other pain control methods, such as topical lidocaine or EMLA cream, are costly and they take a lot longer to become effective rather than using the Buzzy. Using a cold vibrating device such as the Buzzy should be implemented each time needle-related procedures are performed. And the Buzzy is relatively a new device. It has only been on the market for about 10 years. So we are still looking for more research to really validate these results and prove that the Buzzy is a good method to control pain, and there will be more evidence-based practice to put it into actual nursing practice with confidence. Thank you for watching my presentation, and I look forward to watching yours.